Hello, I'm John Brizzolara. I'm a urologist with Ozark Urology with Washington Regional Medical Center. And I'd like to visit with you all today about urinary incontinence. I've been a urologist for 35 years and have a special interest in urinary incontinence and what's known as pelvic floor dysfunction. Today, we're going to focus mainly on the urinary incontinence aspect of that. Urinary incontinence is pervasive. You see this all through a person's life, from an infant all the way up into their 80s and 90s. This first little slide kind of depicts things that can go on. It says, with age comes skills. It's called multitasking. It says, I can laugh, cough, sneeze, and pee all at the same time. Now, even though this is a great accomplishment for this lady, it's not something that we want to go through life with. Another way of showing how prominent urinary incontinence is throughout all our lives is this slide I'm going to show you now, and it's called happiness. And it talks about happiness at different times in our life. The first is you're happy at age 4 if you're not peeing in your pants. Your parents have worked very, very hard in order to try to get you, quote, potty trained. At age 12, happiness is having friends. 16, I can remember when I was 14, everything I wanted to do was just drive a car. So at 16, most of us are pretty happy having a driver's license. At 20, most males are thinking about only one thing, and that was having sex. At age 35, it was having money. At age 50, having money again, and not peeing in your pants. So you see this seems to repeat itself. At 60, having sex, and as you can imagine, not peeing in your pants. At 70, having a driver's license, once again, not peeing in your pants. 75, having friends, and not peeing in your pants. And at 80, just not peeing in your pants. So the slide is there to show that this is a condition that can be bothersome all through our life. And it's something that can interfere with just everyday function, everyday happiness, so we need to be able to try to control this. The facts is that it affects way over 13 million Americans, and unfortunately 85% of them are ladies. It can interfere with their lifestyle, interfere with relationships, interfere with jobs. What is incontinence? Incontinence is the involuntary loss of urinary function. It can consist of maybe just a very few drops or a significant amount of leakage where people are having to wear absorbent pads or even diapers, and some people would even have to wear a catheter in the bladder. Myths. Most people have been told it's a normal part of aging. Well, it's not a normal part of aging. It occurs as we get older, but it's not normal. A lot of people have been told there's nothing you can do about it, you just need to live with it or wear pads. Surgical treatments, they say, are invasive. Some surgical treatments are very invasive, but most surgical treatments that deal with urinary incontinence are minimally invasive and done as an outpatient. And they also state that catheters and daily management products are the base solution. That's a very small percentage where catheters and diapers are the solution. Incontinence, there's 3 main types. The first is called stress incontinence, and this is the loss of urine with any type of activity, such as coughing, sneezing, or laughing, or lifting. The second type is called urge incontinence, and that's the loss of urine when you have an urge to void. You may just be sitting down and all of a sudden have a desire to void and can't get to the bathroom in time, having nothing to do with activity. The third most common is mixed incontinence, and that's a combination of stress incontinence and mixed incontinence. There's several other types. One's called neurogenic, and these are bladders that don't function appropriately secondary to some type of neurologic condition like Parkinson's disease or strokes. And then there's overflow incontinence, which is pretty rare, and that's where the bladder muscle has just stopped. The bladder, it fills up, becomes full, and urine just rolls out of the urethra, more or less like water over a spillway. Stress incontinence usually occurs with the loss of the muscle support in the pelvis. When that occurs, then anything that increases pressure in the abdomen, as I stated before, such as coughing, laughing, and sneezing, actually just pushes urine out of the bladder. If those pelvic muscles are not strong, then they can't prevent the loss of the urine. How does stress incontinence occur? Just like I talked about, weakening of the pelvic floors. Usually occurs in people when they laugh, cough, lift, exercise, anything that increases the pressure in the abdomen that is then transmitted to the top of the bladder that forces the urine out. Causes of stress incontinence, the most common is childbirth, comes with aging, comes with weak pelvic floor muscles, and previous pelvic surgery. When I first started practicing, most of the people that suffered from stress incontinence were 50 years of age and older. And then high impact aerobics came along. People started wanting to be more healthy, jogging, walking, lifting. And what that did was it weakened these pelvic floor muscles. And now we see stress incontinence in very young women in their early 20s. So it is becoming a real problem. People trying to stay healthy by exercising, but it can cause problems as far as stress incontinence goes. Treatments for incontinence, different types. There are behavioral techniques such as decreasing fluid intake, certain types of drug therapies. You can use injectable medications into the urethra or the bladder itself. And then there's surgical procedures where you can put synthetic grafts underneath the urethra and the bladder that will allow the pelvic floor muscles to function as they should. Behavioral techniques such as self-management programs, like I stated, decreasing fluid intake, and there are Kegel exercises that physicians that specialize in urinary incontinence can help people learn how to do, or there are pelvic floor therapists that specialize in this type of muscle exercise. Drug therapies. Drug therapies are mainly focused on urge incontinence, and that's the type of incontinence where an individual has an urge to go. It hits them suddenly and they can't get to the bathroom in time. A lot of my patients will tell me they really don't have an urge to void when they're driving a car, but as they approach the driveway and get the keys out of their purse to open the door, all of a sudden it'll hit them and they'll just lose control of their bladder right there at the front door. So urge incontinence is the sudden urge to void and can't get to the bathroom in time. Medications such as ditropan, Myobetriq, Toviaz, there's multiple different medications that can be used to address that. In urge incontinence, if the medications don't work and behavioral modification doesn't work and pelvic floor therapy doesn't work, there are two other options. One is the use of Botox, which most of us have heard about as far as cosmetics go, but Botox is a very effective treatment for urge incontinence. It's very easy to do. The downside of Botox is it's temporary. The other option in urge incontinence is what's called sacral nerve stimulation, and we can actually put pacemakers on the nerves that go to the bladder that allow us to control our bladder. It's a very, very effective, minimally invasive procedure. When surgical procedures don't help, or behavioral therapy doesn't help, or medication doesn't help, that's when the daily maintenance products such as diapers, absorbent pads, and catheters and pessaries apply. But in the overall scheme of urinary incontinence, the number of people that have to wear absorbent pads or use catheters is probably less than 5%, as long as the correct treatment has been used for the certain type of diagnosis of urinary incontinence. And that's the most important part as far as treating incontinence, is the proper diagnosis. All right, as I was talking about the two main types, urge incontinence and stress incontinence, the urge incontinence we covered as far as the treatment goes. Mainly it's behavioral modification, medications, or sacral nerve stimulation, or Botox. The other main type of urinary incontinence is stress incontinence. And majority of time, most people will go see a pelvic floor therapist or work very hard at Kegel exercises. And in around 20 to 30% of the people, it can make a dramatic improvement in stress incontinence, which is, once again, the leakage with coughing, sneezing, and straining. If that doesn't correct the problem, there is a procedure known as a mid-urethral sling, and that's a minimally invasive procedure. It takes approximately 5 to 10 minutes to do the procedure. It's done under a general anesthetic. Once the sling is implanted underneath the urethra, the individual's instantly dry. They can drive a car in 48 hours. The downside is that they just can't do any really heavy lifting or straining for approximately 2 weeks. So the two main types of incontinence, once again, are urge incontinence and stress incontinence. And it's very, very rare that you can't correct it where the patients don't have to wear absorbent pads. Thank you.